7 warning signs your kidneys are in danger. Never ignore these. After 60. Hi, I am Dr. Sienna Black, and before I get into today's video, I need to tell you about a patient of mine. Her name was Dorothy, 72 years old, retired school teacher, gardening every morning, baking on Sundays. From the outside, she looked perfectly fine, happy, healthy, active. But 3 months before she came to see me, Dorothy ended up in the emergency room. Not because of a fall, not because of her heart. Her kidneys had been quietly failing for over a year, and nobody caught it. Not even Dorothy herself, because the signs were there. They had been there for months, but nobody told her what to look for. And that is exactly why I made this video today. Because what happened to Dorothy happens to millions of Americans every single year. And most of them are over 60. And most of them had no idea until it was almost too late. So if you are over 60, or if you love someone who is, I need you to stay with me for the next few minutes. Because what I am about to share with you could genuinely save a life. Maybe yours, maybe someone sitting right next to you. Please do not scroll past this. Please do not save it for later. Watch it right now. Because your kidneys may already be sending you warning signals, and if you do not know what those signals look like, you will miss them every single time. Just like Dorothy did. I am an internal medicine physician with over 15 years of clinical experience, and I have spent a significant part of my career working with older adults managing chronic conditions, including kidney disease. I see patients every single week who come to me with symptoms they have been brushing off for months. Fatigue they blamed on getting older, swelling they thought was just from standing too long, changes in urination they felt too embarrassed to even mention. And time and again, when we run their labs, we find that their kidneys have been struggling quietly in the background. So today I want to give you the information your body deserves. I want to walk you through 7 warning signs the way I would explain them to a family member sitting across from me in my office. Not with complicated medical jargon, not with scary statistics designed to overwhelm you, just honest, clear human information that you can actually use. So let us get into it. But first, I want you to understand something really important about your kidneys, because most people do not think about them until something goes wrong. Your kidneys are not like your heart or your lungs. You do not feel them working. You do not feel them struggling. They are silent workers, sitting quietly in your lower back, filtering your blood every single minute, removing waste, balancing fluids, regulating your blood pressure, producing hormones that keep your bones strong and your red blood cells healthy. They do all of this without ever asking for your attention. And that is exactly what makes kidney disease so dangerous. Because by the time most people feel something is clearly wrong, by the time they actually feel sick, up to 70 or even 80% of kidney function may already be gone. 70 to 80%. Think about that for a moment. Your kidneys can be more than halfway destroyed before you feel a single obvious symptom. That is not a scare tactic. That is medical fact. And for people over 60, the risk is even higher. Because as we age, our kidney function naturally declines. Our blood vessels get stiffer. Diabetes and high blood pressure, 2 of the leading causes of kidney disease, become more common. And the medications many seniors take every day can quietly stress the kidneys over time. So the combination of age, chronic conditions, and medications creates a perfect storm. And millions of older Americans are living right inside that storm without even knowing it. But here is the good news. Kidney disease does give warnings. They are subtle. They are easy to dismiss. They mimic other common conditions. But they are there. And once you know what to look for, you cannot unsee them. So let us go through all 7, one by one. Warning sign number 1 is a change in how often you urinate, and what that urination looks like. Now, I know this is not exactly dinner table conversation, but I need you to pay attention here because this is one of the most important early signals your kidneys will ever send you. Your kidneys are responsible for producing urine. That is how your body gets rid of waste and excess fluid. So when your kidneys start to struggle, urine production is often the very first thing that changes. And it can go in either direction. Some people start urinating more frequently, especially at night. You used to sleep through the night just fine, and now you are getting up 2, 3, even 4 times to use the bathroom. Doctors call this nocturia, and while it has other causes, it can absolutely be an early sign that the kidneys are not filtering efficiently during the day. In other people, the opposite happens. They urinate less. Their urine becomes darker and more concentrated. Sometimes it looks brownish or tea-colored, which can indicate that blood or muscle proteins are being spilled into the urine, a very serious sign. And then there is foamy urine. If you flush the toilet and the water looks unusually bubbly, not just a little foam, but persistent foam that does not go away quickly, that foam can indicate protein in the urine. Healthy kidneys keep protein inside your bloodstream where it belongs. When the kidneys are damaged, they start leaking protein into the urine. And protein in urine creates that characteristic foam. This is called proteinuria, and it is one of the earliest and most important signs of kidney damage that we look for on lab tests. So pay attention to your bathroom habits. Your urine is one of the clearest windows into your kidney health, and changes in color, frequency, volume, or appearance should never be dismissed, especially after 60. Warning sign number 2 is swelling, particularly in your ankles, feet, and legs. And this one gets misattributed more than almost any other symptom I see in my patients. People tell me all the time, oh, it is just because I was on my feet all day, or it is just old age, or my shoes were too tight. And sometimes, yes, swelling has a simple explanation. But persistent swelling that keeps coming back, swelling that is worse in the morning before you have even been on your feet, swelling that leaves an indentation when you press your finger into it, that kind of swelling needs to be taken seriously. Here is why it happens with kidney disease. Your kidneys regulate the fluid and sodium balance in your body. When they stop working properly, excess sodium and fluid build up in your tissues. And because of gravity, that fluid tends to pool in the lowest parts of your body, your feet, your ankles, your lower legs. In more advanced cases, it can affect your hands, your face, even your abdomen. Now I want to be clear, swelling in the legs can also be caused by heart failure, liver disease, venous insufficiency, and certain medications. So swelling alone does not automatically mean kidney disease. But if you are experiencing persistent unexplained swelling, especially combined with any of the other signs we are talking about today, please do not wait. Get your kidney function tested. It is a simple blood test. It takes minutes, and it could change everything. Warning sign number 3 is fatigue, and not just ordinary tiredness. I am talking about a bone-deep exhaustion that does not go away no matter how much you sleep. A kind of tiredness that makes you feel heavy, foggy, and completely drained even when you have done nothing physically demanding. This type of fatigue is extremely common in people with declining kidney function, and it happens for a very specific reason. Healthy kidneys produce a hormone called erythropoietin, EPO for short. This hormone signals your bone marrow to produce red blood cells. Red blood cells carry oxygen throughout your body. When your kidneys are damaged, they produce less erythropoietin. Less erythropoietin means fewer red blood cells. Fewer red blood cells means less oxygen reaching your muscles, your brain, your organs. And that oxygen deficiency is what creates that crushing, unrelenting fatigue. This condition is called anemia of chronic kidney disease, and it is incredibly common in older adults with kidney problems. The tricky part is that most people, and honestly even many doctors, assume that fatigue in a person over 60 is just a normal part of aging. And sometimes it is. But persistent, worsening fatigue that is accompanied by weakness, shortness of breath, difficulty concentrating, and paleness, that combination should always prompt kidney testing. Do not let anyone tell you that feeling exhausted all the time is just what getting older feels like. It is not. Your body is supposed to have energy, and if it does not, something is wrong. It deserves to be investigated. Warning sign number 4 is persistent back pain or a dull ache in the sides, what we doctors call flank pain. Now I want to be careful here because back pain is one of the most common complaints in adults over 60, and most of the time it is muscular or skeletal. But kidney-related pain has some distinctive features that set it apart. Kidney pain typically presents as a deep, dull ache located in the upper back, just below the rib cage, on one or both sides. It does not usually radiate down the legs the way sciatic nerve pain does. It does not typically worsen with movement the way muscular back pain does. Instead, it tends to be constant, located deeper than muscle pain, and often accompanied by other symptoms like changes in urination or swelling. Kidney infections, kidney stones, and polycystic kidney disease are conditions that commonly cause this type of flank pain, but even declining kidney function without a specific structural problem can cause discomfort in the kidney region as the kidneys become stressed. If you have been experiencing a persistent dull ache in your lower back or sides, particularly if it does not respond to typical pain relief measures, and especially if it is accompanied by any changes in urination, please mention this specifically to your doctor and ask for kidney function testing. Do not assume it is your muscles. Ask specifically about your kidneys. Warning sign number 5 is something that sounds almost too vague to be meaningful. But in my clinical practice, it is one of the most telling signs I look for. It is a combination of nausea, loss of appetite, and a metallic or ammonia-like taste in the mouth. When your kidneys are not filtering waste effectively, toxins and waste products begin to accumulate in your bloodstream. This condition is called uremia, and even in its early stages, before it becomes severe, it can produce a range of digestive and sensory symptoms. My patients describe feeling vaguely nauseous throughout the day, not sick enough to vomit, just persistently unsettled. They stop feeling hungry. Food that used to taste good suddenly tastes off, metallic, or just wrong. Some people notice an ammonia smell in their breath or a persistent bad taste that brushing their teeth does not fix. Others develop hiccups that will not stop or feel full after eating only very small amounts. These symptoms are easy to dismiss. Nausea could be stress, loss of appetite could be depression, a bad taste in the mouth could be dental issues. And yes, all of those are possible explanations. But when these symptoms are persistent, when they come together as a cluster, and when they occur in a person over 60 who has other risk factors like diabetes or high blood pressure, the kidneys need to be on the list of suspects. Uremia is serious. It means the kidneys are significantly compromised, and it needs medical attention promptly. Warning sign number 6 is something that many of my older patients experience but almost never connect to their kidneys. It is difficulty sleeping, specifically a particular type of restless, uncomfortable sleep disruption caused by something called restless leg syndrome. People with declining kidney function often develop this condition, an uncomfortable crawling, tingling, or aching sensation in the legs that becomes worse at night and is temporarily relieved by moving the legs. It makes it nearly impossible to fall asleep or stay asleep. The connection between restless legs and kidney disease is well established in medical literature, though it is not widely known among the general public. It is thought to involve the buildup of uremic toxins affecting the nervous system, as well as imbalances in iron and certain minerals that the kidneys help regulate. Beyond restless legs, kidney disease also disrupts sleep through sleep apnea, which is significantly more common in people with chronic kidney disease, and through the general discomfort of fluid retention, itching, and nighttime urination that we have already discussed. If you are over 60 and you are struggling with sleep, if you find yourself waking frequently, unable to get comfortable, or experiencing that restless crawling sensation in your legs at night, please do not just reach for a sleeping pill. Ask your doctor to check your kidney function. Sleep disruption is not just a quality of life issue, it is your body telling you something is wrong. And that brings us to warning sign number 7. This one is the one that catches my patients most off guard. It is itching, persistent, widespread itching that has no obvious skin cause, not a rash, not dry skin that lotion fixes, but a deep, internal itch that seems to come from underneath the skin, that moves around the body, that is worse at night, and that nothing topical seems to touch. This type of itching, called uremic pruritus, is caused by the buildup of waste products in the bloodstream that the kidneys are no longer filtering out adequately. These waste products deposit in the skin and trigger an immune response that manifests as intense chronic itching. It is incredibly distressing. My patients describe it as maddening. Lying awake at night, unable to stop scratching, with no visible cause and no relief. And because the skin looks normal, many doctors initially dismiss it or attribute it to dry skin, allergies, or anxiety. But uremic pruritus is a real and significant symptom of kidney disease, and in older adults it is frequently misdiagnosed or simply overlooked. If you are experiencing persistent unexplained itching, particularly if it is widespread, worse at night, and unresponsive to moisturizers or antihistamines, please advocate for yourself. Ask your doctor specifically about your kidney function. Ask for a comprehensive metabolic panel. Do not let this be brushed off as dry skin. So let us bring all 7 of these together. Changes in urination, in frequency, color, volume, or the presence of foam. Swelling in the ankles, feet, and legs that keeps coming back. Persistent deep fatigue that sleep does not fix. A dull, aching pain in the back or sides that does not respond to normal pain relief. Nausea, loss of appetite, and a metallic or ammonia taste in the mouth. Sleep disruption, restless legs, and difficulty staying asleep. And persistent unexplained itching with no visible skin cause. These are the 7 warning signs, and I want to be very clear with you. You do not need to have all 7. Even 2 or 3 of these symptoms appearing together, especially in a person over 60 with a history of diabetes, high blood pressure, heart disease, or a family history of kidney problems, that combination warrants a kidney function test immediately. The test itself is simple. It is a blood test that measures something called creatinine and calculates your GFR, your glomerular filtration rate, which tells us how well your kidneys are filtering. A urine test can check for protein. These tests are inexpensive, they are widely available, and they can catch kidney disease years before it becomes critical. Early detection changes everything. Caught early, kidney disease progression can be significantly slowed, sometimes stopped entirely, through blood pressure control, blood sugar management, dietary changes, and appropriate medication. But none of that is possible if you do not know the problem is there. I want to close by coming back to Dorothy. Dorothy is doing better now. She is on medication. She is monitoring her blood pressure carefully. She has made some meaningful changes to her diet. Her kidney function has stabilized. It will not go back to where it was before. That damage is unfortunately permanent, but it is not getting worse. And she is back in her garden. She is baking on Sundays again. But she told me recently, Dr. Black, I just wish I had known sooner. I wish someone had told me what to look for, and that is exactly why I made this video, not to frighten you, but because knowledge is the single most powerful tool we have in medicine. You knowing these 7 signs costs nothing. It requires no prescription, no procedure, no insurance authorization. It just requires attention. Attention to your own body. Attention to the signals it is sending you. Your kidneys have been working for you every single minute of every single day of your entire life. They have never asked for anything. The least we can do is pay attention when they finally ask for help. So please, check in with your doctor. Ask for that blood test. And if this video helped you today, please share it with someone you love who is over 60. Because the earlier we catch this, the better the outcome. Every single time. I am Dr. Sienna Black, and I will see you in the next video. Take care of yourself. Your health cannot wait.